Pyelonephritis, infectious tubulointerstitial nephritis, infection involving the renal parenchyma and renal pelvis. Isolated pyelitis or infectious nephritis is extremely uncommon. Chronic pyelonephritis with renal scarring may develop in patients who had childhood pyelonephritis or who have renal tubular necrosis caused by overconsumption of phenacetin derivatives. Chronic phenacetin-associated pyelonephritis is usually found only in elderly patients with past exposure to phenacetin derivatives because these agents are no longer used in most countries. In elderly patients with pyelonephritis, bacteria invade the renal parenchyma, usually from the renal pelvis. Reflux of urine from the bladder during micturition, ureteral or pelvic calculi, congenital or acquired pelvic deformity, or renal parenchymal disease all increase the risk of pyelonephritis. Infection of the renal parenchyma directly from a hematogenous source, although infrequent, may occur in debilitated septic patients. Signs and symptoms. About 8 to 10% of all patients with symptomatic UTIs have pyelonephritis. The percentage in the elderly is unknown. These patients may present with an initial history of cystitis. Typical symptoms are fever, chills, and back pain, which may be unilateral or bilateral. Bacteremia occurs in up to 25 to 30%. Sudden clinical deterioration may indicate septicemia. And that's pyelonephritis. Have a great day.